What's up, people? Welcome to my channel. My name is Emi Devi. Thank you for joining me this day of 26th. What we talk about today, have you subscribed? And have you subscribed to Emi Dev to get the updates about health and everything related to health? And comment down below what you think we should improve on. Thank you for the previous input, those who called me, those who texted me, those who watched and did say nothing, those who liked. It's encouraging, and let's do this. Today I want to continue with the series we began about nursing and talk about major issues in nursing. A young girl has been admitted to the medical training college. They have reported, or they have reported to the university to do nursing, and on reporting there, you do your classwork orientation and every single thing. Now reaches the time for clinical experience. You know, in the nursing career, it is a performance-based profession. Nursing is performance-based. If you don't know how to do something, as much as you're knowledgeable, so when it is performance-based, it means like you have to go to all various learning centers, like all wards. The rotations in the nursing career, you will have to go to the pediatric and see how pediatric nursing is done. You go to ICU, HDU, see how ICU care is done. You need to go to maternity and get that experience. You need to go to the medical surgical areas and get that experience, and all of them. If you're a nurse, you know what I mean. And if you're aspiring to be a nurse, comment down below so that I can talk about the various areas you go for experience and the experience you get there. So you've done your theory, and you've been given your rotation where you're supposed to be going. Now it reaches a day to go for the clinical, and usually you are put in the duty rota. There are challenges experienced. It's a very interesting thing to go to the ward setup. I remember the first days I went to the ward, it's like, I am finally a nurse. I am finally. Communication. Your colleague, your senior colleagues especially, might give you wrong information, or you might not be able to communicate with them well. And especially if you're going to work in a place where there is a language barrier, you will experience ineffective communication. Remember, one of the attributes of proper nurse is proper communication, effective communication, whereby you'll have to give information or receive information from the other person properly, information that will enable you to function. So that is one of the issues. And under ineffective communication, you'll also experience discrimination. When you talk about discrimination, what do we mean? You'll get senior students, junior students. A training institution has medical students, senior students, physiotherapy students, clinical medicine students, and all these medical career students. So you, as a junior nurse, let me begin there, as a first-time nurse going to the department, you might find a senior staff or other cadres getting discrimination against others. When I was a student nurse those days, you find medical students, or let's say registrars. When we say registrar, is the medical officer who is upgrading to be a consultant, and when they come to the department, they might be treated well, but as a first year nursing student, it's like discrimination. As senior nurse will say, students, stop crowding there at the nursing station. Students, take this there, as in, like, are you feeling it? That's one of the challenges. Be ready to brace it, because it happens, and it's not gonna change. It's not gonna change. It kind of happens unconsciously. Hey, now let's get to work. Communication has been sorted out. Let's get to work. Inadequate readiness. Girls and boys, ladies and gentlemen, if you're gonna be a nurse, you're gonna be a nurse, right? Or if you're gonna be a clinical officer, you're going to be a clinical officer. You need to know all the things pertaining to what you are. Nobody is going to tolerate inadequate readiness that you will come along with. This is a major challenge that we need to address as senior nurses and as student nurses. if you've been sent to a pediatric unit, for example, or a NICU, or a PICU, or maternity, or theater, or somewhere, ensure that you have proper knowledge. One of the things that is affecting student nurses is, for example, they come to a pediatric unit, the pharmacology that is entitled, you are entitled to know, you don't know. Somebody tells you go and administer such and such a drug, they ask you the side effects, you have no idea, then that will frustrate your life. Trust you me, it will frustrate your life. Deficient practical skills. In training in nursing, before you go to work on the patients, there is something called skills lab. In the skills lab, that is where you work with the dummies on, for example, the procedure is putting an NGT. NGT is that tube that you are put to give you food through the nose, the throat, and esophagus down to the stomach. That is where you practice that skill, or the skill of suturing wounds and everything, or the skill of what is it? Why am I forgetting them? They'll come. Or wound dressing, or putting cannulation and giving drugs by the time you move to the patient. So my dear, if you've not perfected your skills in the skills lab, you're gonna have it tough when you're going to do it with the real patient. And you will have a discrimination from the senior staff, and especially if you can't communicate well that I can't do this. And again, who is going to be teaching you things that you are meant to come knowing? You're just coming to get the confidence and every single thing. If you're not perfect still, you have the choice of going back to the skills lab to learn them out and work with your colleagues. But you are expected to do what you're expected to do at your level. Then we have insufficiently developed communication skills. When I was a student nurse, you find like you are in front of the patient, and in front of the patient, some things that you're not supposed to talk where the patient is, you find yourself talking. This is a challenge, and it usually comes. So what you're meant to know is, as you grow, as you mature in this career, you know things to talk in private. You know, why are we saying that? If, for example, you talk before a patient of something that you are not meant to speak, the patient might lose confidence in you. And of course, you are a student. You are not the qualified. You don't work alone. But if in case you are assigned to do vitals alone, or you need to do vitals, even the patient might refuse you touching them, right? So ensure that you have adequate readiness if you've been sent to a particular department, so that when you get there, you work efficiently. And now, finally, emotional readiness. Oh dear. There is stress. Stress. Ask those student nurses who went to maternity for the first time, and then they saw the normal delivery of a baby, and you were not ready for the amount of blood or the way the baby is popping out. What? When I was a student, some ladies fainted. Others were like, oh my gosh, in the presence of it is allowed. That is emotional readiness. It depends on how ready you are. For example, getting exposed to a new skill. Every nurse graduate, there is a skill that up to now they kind of struggle to perfect, that whenever the skill, I don't want to expose mine because somebody will say, now this is not a qualified nurse. But I'm telling you, every single qualified nurse, there is one particular skill they have never been exposed to. As much as you're exposed to everything, there is one skill that you can still struggle to be competent in. Now, what if when you are a student, every time you're going to be exposed to a new skill, my friend, the first time I did cannulation. Cannulation is that putting of a line to put a drug in. Where? Yani, when you're told that you're going to do cannulation, that day you don't sleep. Yani, you are imagining. You go to skills lab and you try to put, then you're imagining. You look at your vein. Anyway, being a student nurse. Putting of an NGT tube. Wow. That day I was meant to do that procedure. Wow, 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 wow. I tell you, the day I was going to do delivery myself, me now. Wow. The first day I was meant to give an IM injection. I remember. Ooh, I was in the medical surgical ward. No, orthopedic ward. Yeah, orthopedic is surgical. I was in the orthopedic ward. And the drug was, what was the drug again? Tramadol. Tramo. My friend, I don't want to name her. So they had imagine such a simple procedure. Guy, students, my friend, we felt it, even us. So as you go to nursing, you tell God today, God, I'm going to do an IM. Please help me as I do this procedure. I do it to the best of my knowledge. Please, this drug. Hey, wait until when I was giving, which drug is that? The drug that when you push in, the patient might start vomiting immediately. So, aminophylline drug. Aminophylline drug, we were giving it to a patient who was asthmatic, and this patient, we didn't have a neb kit, a nebulization kit. It's in a dispensary, a very cold area, and now you have to push. You remember this drug, you push slowly. It's like potassium. Well, every time you give a new drug, there is a new experience. But every time you do a new procedure, there is a new experience. So these things, and lastly, it is something called inferiority complex. Student nurses experience this so often, and especially if you're a junior nurse and you're in the presence of senior nurses. Senior nurses are these things are normal from training school to working setup. Whenever you are in a junior level, you feel inferior, and especially if there is a skill you are not super competent. So when you are a student nurse, let's say first semester, and then you are rotating together with a senior nurse in their fourth semester or their final year, inferiority complex inakuaga hapo. Oh, you're told go do vitals, and then when you do vitals, there is this manual, this fig, and then you do pressure. Tell a patient, and then you put it here, and then you are supposed to do, you put your fingers here, to get the pulse. Then you put the stethoscope. I should bring these things practical. You put the stethoscope, and you're now listening, and you're not feeling nothing. Every student nurse experienced this. I don't want to remember mine. And you are a whole team of 12. Have you heard it? What did you hear? Nothing. And then somebody will ask you, what's the pressure? 120/70. Oh no. Hey, issues of clinical experience in nursing training. Hey, when you see a senior nurse out here working with confidence, somebody really put their time to mentor them well. So clinical instructors in those areas, kindly hold those girls, hold those boys, so that at the end of the day, when they stand up like us right now, they can tell you the difference between a different wound dressing and everything. Fine. So you should know that nursing is a competence-based profession. Your certificates don't matter, including administration. Including nursing administration, your certificates are good. But if you cannot perform that thing, let's join again next time to see the beautiful experiences in nursing career. Thank you. Subscribe, call your nursing colleagues, and let's do this together. Thank you and bye-bye.